Well, greetings again, and this is Dr. Bill Wyatt with the American Orthodontic Society, and I want to cover something here that if you do orthodontics, you need to kind of know a lot about how teeth move in the bone and how the bone moves and how it fills in and does all these good things where you can do these things with teeth, and then also know that a tooth can be ankylosed, or if it gets damaged and the blood down in there goes between the tooth and the bone actually can grow to the tooth in a certain spot, and that tooth is just won't move in the relationship with the bone. Now you move the bone and the tooth to different places together, but you can break these teeth loose, just fracture that contact where it's grown together. The bone is grown into the tooth itself, and you don't have the periodontal membrane there. When you've got the membrane, you put pressure on it, and the body, the little cells, will come and move the bone from one side to the other and carry it around. And after you get the tooth over there, you can't tell that bone from other bone. It changes all the time. And people's bone moves and changes all your life. It's the way you do things. So let's get on with this, and I want to show a few pictures in this, just to give you some idea when we're talking about cortical bone. Now this bone right out here, you see it doesn't look very thick, but this is solid bone. That's cortical bone. This is cancellous bone. It's in between the teeth. Now I know I'm talking to orthodontists around the world. You know all this, but there are people who started and don't really realize what the bone is like around the teeth. Now, this cortical bone is many times thicker and denser than the cancellous bone, and this cortical bone and the other, when you do hard labor, and if you just start and work up, your body will strengthen the bone in the area you're working on. Like astronauts go up, and if they stay up there very long where there's no gravity pull on, their bone weakens, and it's not necessary for it to be that strong, so they'll urinate out the calcium in the bone. A lot of the calcium, they get back to earth, they have to be careful. They have to let the bones adapt again to the gravity that we were in. And sometimes they work out and do all that, but they can't really replace constant gravity which on the body, and we have to develop bone structure that supports our body, and we don't even feel it a lot of times. But the way we move teeth in bone, you have to watch. You don't want to let the cortical bone close in. I've got 2 or 3 pictures here. Let me get one of them right. Okay, here's one where a tooth is, say, we slip it out in here, and people ask me, we close the space immediately. When you take a tooth out like that, you start moving this tooth into here and this one into this area, and you get them in there while this cancellous bone is out here. If you leave this alone for several months, the cancellous bone doesn't have any work to do out here. It moves in like this, and then gets further in, and it'll do it from this side, this side, this side, until finally, if you wear a bridge over here, and over a period of years, this cancellous bone will come together, and you'll have just a knife edge ridge of cortical bone, which is very hard to move a tooth into cortical bone, but you can do it if you just gradually keep pushing. But it'll take 2 or 3 or 4 times longer to put this tooth together. But when you take out a tooth and you want to close the space up here, you get everything ready. You have your brackets and everything on place, and you pull this tooth into this tooth, and you want it to come in bodily. Now I'm gonna go in here and just I'm gonna erase this, and I'm gonna put just a white field up here, and we're just assuming here is a tooth. This, say, is a second molar, something like that, and we extract a 6-year molar that would have been sitting right in there, and there'd be a bicuspid over here coming down like that, and we want to pull this tooth over to here, and we don't want this one to come back to that. In other words, if you don't want to close the face in any, you can put a pin or a little screw in the bone, in the cortical bone now. Get out to the side of the tooth, it's better, and take the head of it and bond that tooth to this screw to this tooth right here. And now I can pull on these teeth back here. Now if you had a wisdom tooth, it would be somewhere in here, this area. And you can pull on those teeth and slide this up here, and this won't move back enough to even know. And if you're looking at it down from the top, your bicuspid, and you got a molar back here, put the pin kind of in the side so the tooth can come right up here to it, and you've still got this tooth bonded on down here. When you get the final part, you can put a class 2 elastic in and pull them from the front and close that there. Now, it's critical that you go back and do that immediately. It's the time that required to move the tooth together like that would be reduced by many times. I'm going to erase that now, and we'll go back. So if you want to close this, you put your pen in here and you hold it if you don't want this to move back, and you pull on this, and this will come forward in here, and you do it immediately. I get everything ready, and when you take the tooth out, put some gauze in there when it stops bleeding, everything, you can go in and start pulling that tooth into that space. And then I can close a space, even a molar space, in maybe a couple of years or something like that, or maybe even less than that. You can go in. I can probably get them together if I get it really at the right time. In about 3 or 4 months, I've got that tooth over there together. Now, you don't pull a tooth. I'm going to have to show you another, go back over here and show another drawing up here. Like we've got this molar tooth here, and I'll just try to draw this as quick as we can. And this is a bicuspid tooth right in here. And we want this to move up here. So we've got teeth all the way around, and if you had a gap over here, you could do the same thing to it. When you come through your bracket back here, this wire would come through, and it's about somewhere along in here, you make a spring that's going to, as we pull this tooth over here, we want the tooth to move straight in, like if you had this tooth back over here. I'm sorry, we're moving it. We want to move the crown along with the tooth. In other words, we want to pull this over and have the tooth come in just like that. All right, what we got to do here is when the archway comes across here, you stop, you make a circle like that, and now you put this down in this fashion. Now and it doesn't matter if you've got 2 teeth back here, you can run this wire right on there, and you put this wire through these teeth right here. When I pull this up to hook it, it tightens this spring up right here. Now I can put a wire through this loop and come down and put it over there. You got a bracket here and say a tube here, you know, this sticking out. You tie this wire here over here real tight and pull it in. If this were just in the air, I mean, you just put this in and these teeth were just sitting in a liquid of some sort, the teeth would come down and the roots would be coming in this direction. You've got to visualize in here. If I move this part right here down, these teeth would be going. But I put force on this. This is pulling in this direction. And so instead of the roots coming over this way, if we just let it sit there, the roots would come forward and the crown wouldn't. But you pull on this, you shorten your arch wire, and you close this up over here. You may put a little U in the arch wire, and that shortens it, and I pull on this hard, and that brings this crown, both teeth will come forward, and the roots will come in this way. If you didn't pull on this, the teeth would angle like this, and the roots would be sticking out in this direction. It's hard for me to pass this on. And this, a lot of people call, well, it takes me forever to get the space close together. You just don't, they don't do it the right way if you do. Now, as you shorten this arch wire, you'll shorten this, and it'll pull this thing will shorten over to here, and it'll pull that thing right on up and hug it right up beside that, and the roots will go down. Roots will be back in here just like they are over here. And you can look at the bone structure a year or so after you've pulled them up there, and you can't tell any difference from this tooth or before they started moving into that area. Now there's another thing about uprighting teeth. I want to draw a little bit and show you that while we're doing this drawing. Now, I want to give us another white place where we can draw. Now you're going to upright a tooth, like you've got a say a bicuspid up in here. It's coming down, and we've got a molar tooth over here that's laying down, and the roots of it are back in this area right here. Now, if I want this tooth to go back like this, to raise it this way, I come in here with almost the same identical thing. Like you come across here, you've got to drop down somewhere to get this, and you put a tube in this tooth right here. Except now that we know what to do, you can do it with one arch wire, but you got to drop the arch wire down and come this way. So rather than do that, we run back a wire here, and we take this right here, and we put a wire in it that's got a little deal like this, maybe 2 rounds, and we build it over here. We stick that in here. Well, we put this in, and this comes out here, and this deal is turned this way, and this wire goes out here. Now you got another tooth over here on the bicuspid. You take this wire, brace it up, and hook it to one of these teeth here. You put a little hook in that. Pull that spring up and hook it. Now, if you don't pull this way, the tooth is going to move out in this direction. It'll straighten this tooth up, and you can put this tooth right like this back here. The roots of the tooth will go back with it in that fashion. But if you wanted to close it together, you've got to tie that spring in here, and you can slide this tooth. The roots will come forward, and we've got cases showing you a gap in between these teeth. It stayed the same while we brought the roots forward. Then when we got them straight up and down, we just pulled the whole thing over in a parallel line with these other teeth right here. Now it's hard for me to pass this on to people, to show them. And people say, well, it takes so long to. If you do it right, those teeth will move over like that quicker than you think. And you can have them close it against teeth. Don't grind the tooth off. The occlusion will shove this tooth down, and your tooth will come in there. You still have this tooth will be shaped like this, and this tooth up here will fit against it good, right there. And you can do more than one tooth back here. You can do the whole thing if you do it. And so that's the way we close space in teeth. Now I want to get back in here, and we'll erase this, and I'll show that back, and I want to go back and show the bone structure again. Now this is the root sticking down here in this bone, and it's in the cancellous bone, but it goes through cortical bone up here at the top, and this part is in the cancellous bone. So it's kind of softer down here. Now just remember that. Now this is the cortical bone goes up around the jaw right here, and this cortical bone will get thicker and stronger the more pressure you put on it. If you do it gradually, it toughens up. And you've got to be drinking your milk and get your calcium and all that stuff. And people who osteoporosis, this bone, the calcium leaches out of the bone, and this bone gets soft as all get out. I had a lady that was bad osteoporosis, and her teeth were just terrible. And I thought it was going to take me a long time to do it. And in 11 months, I had moved those teeth all over the place. With the cancellous, the cortical bone structure and the cancellous bone was just soft, and the teeth could move. Boy, if she leaves a retainer out for a week, I mean, the teeth would just shift back. They just move all over the place. And people can fall with osteoporosis like that. These thin bones, they can break just bumping them good. I talked to an old surgeon who's a friend of mine. He and I went to school together, and he said he was operating on somebody with osteoporosis, and he reached up to get the bone structure to put it together, and he could just mash it together. I mean, people's bone gets extremely thin in this, and I guess if an astronaut stayed up there for years, his bone would get awful thin unless he took a lot of exercise to strengthen the bone structure. They come down to earth, and you got gravity constantly pushing and pulling on you, and your bone structure will get stronger. I remember a man who they loaded ships, but people would go down there and they'd put big bags of stuff on their shoulder, maybe 200 pounds, and they go stack it back in the hold of the ship. And those people would get so strong. I mean, their bone structure, if they started this slowly and gradually worked up, their bone structure just gets tremendously strong like that. So anyway, bone will heal itself and grow together again too. Now, I'm gonna teeth move in bone. It's kind of like putting a fence post in. Let me get back here. And here's this cortical bone on the outside going like that. If you want to lengthen or shorten your jaw out here, you can cut down on one side of it, cut across the top, and cut on the other side, and you can take this and section it out, and move it out like this and screw it together so you make the jaw longer, that much longer by old surgery. And I've screwed it and helped people, old surgeons that did cases for me. They'll let you come in and help them or watch them do this, and you lengthen the jaw that way, or shorten the upper jaw. In the way they work with the bone, it is amazing how they can do these things and put it together that it grows back. Just thank God they live to do this. Now, I want to draw a thing here and show you kind of the way. Let's see if I can get this up again. Now, if I'm putting a fence post in, one summer I worked one whole summer doing fence posts, and the grounds would come along like this, and it'd be hard as all get it, and we dig a hole down here, and we put a post in it. So we'd go in there and put a post down in this. Maybe it wasn't as big as the hole, and we'd pack stuff in there. Now you've got a fence post up here, and the fence is attached to here. And if I pull on this post going this way, it will tend to move the dirt over this way. And this end of the tooth, the post will go out. And if this is soft, the post will set up like this. And you could tie it up here and rain and everything is soft as earth. And this spoof sometimes will come way over like this, and your fence is tied to it. And that's not what you want. Now, I have here on the ranch we have a skid steer, and you can get all kinds of attachments for them, and we can drill holes in the ground like in just a few minutes, go down about 5 feet. And so now when we use a big post in there, we'll go down in the ground and put a large post in the ground down like this, and we'll put some concrete down in this area, and then we fill it up, and then we put some concrete in here, and say this post is sticking way up here, you're pulling on it over here. If this is hard, that post can't move, and this is hard, it won't. If this is soft and this is hard, this will move, and this will move out in this direction, and this can wiggle up in this area right here. Now, when we move teeth, the root structure is depending on how much bone you got on them, but it may be this much here. If I push on this tooth, this one doesn't go down. Now this one, if I just try to move it over, this tooth will lean over here. You don't bury this tooth here. It pretty much stays where it was. This one will come out of the bone structure a little bit, and now the tooth will be lying more like that when it comes out. So whatever you're doing with teeth, you have to think about the root is in the bone. And when we want to put this buccal root torque, say for instance, we want this upper tooth to close like this, and we've got the roots of it going up in here, and we want to put pressure on these roots to go out, like you put a big daddy arch wire in here and you're pulling this out. If you don't put something on your tooth, you don't put a lot of torque on this tooth will go out, the roots will go in this direction, and the crown will go in this direction. It'll rotate somewhere in this bone like that. So I'm going to erase this, and let me show you what you have to do. Now, if you have a upper tooth like this, and it's coming up. All right, and your upper tooth is supposed to be closed like this, but together. And this keeps the cheek from going in between the tooth right here. Now, if I want to expand this arch and move this tooth in this direction, or say if it's the mouth breather, this tooth here will be setting in with the lower tooth sticking out like this, and you bite your cheek in there, so you don't want that tooth to move. So you've got to put a bracket on the tooth, you know, and you run rectangular wire back here. Now you take your rectangular wire and you get up here around behind the cuspid tooth. You take a plier, put on it, and the rectangular wire will be moving like this. And you go back at the end of it and you bend it up like that. So just picture that, except it's laying down in this fashion. Now I pinch this wire here with a plier and don't let it, and I go back over here and I turn this around until this is turning down. This thing will be turning down like that. Now, so here the wire is twisted from here to there, and this tail end is down, and we're going to have to, in other words, it's going to be headed like that. And so I have to take that wire and bend it up like this and stick it into this bracket right here, this wire that's setting out like that. We stick it in this bracket, and that wire is trying to do this. It's trying to move this tooth over here. Now, if you just left that wire, we call that buccal root torque. It's trying to move the tooth out in that direction. But the wire is bending it to tooth over here, but the root of the tooth in the bone structure, and the root moves much harder than the crown. So if you just put that wire with that torque in it, this crown will move back in this direction. Instead of you getting buccal root torque, you would get lingual crown torque. Now, it's hard to get this across to somebody who has just begun to mess with it. But when you use this big arch wire, it'll expand anything walking, breathing, alive. I don't care how old they are, what color their skin is, and where they are in the world. It'll move the teeth out. You can run it out here, use an old 4-0 wire, and you don't even have to heat treat it. And that thing will bring this crown out. So when you want to move this tooth out bodily, you don't want to tip it and have it go into the roots going over here, the crown over here. So you put buccal root torque in a rectangular wire, and that's the way. Your wire's got to be down here. So if this is the bracket, your wire would be like this. You twist that wire where it's maybe up, you got to bring it all the way up here. You put it in that slot, and it's going to move that tooth in that direction. But if you don't support it, the arch wire doesn't have a lot of lateral force to it, but this big daddy wire has all you want. You just make it straighter and pull it in there and hook it up, and there's no way this crown's going to go this way. It's going to go this way. And now you spread the tooth, and you can take this tooth right here and have it sitting right out here if you want to leave it in there long enough, and you can pull it out like that. Now, people who know how to do things, I mean, really, will make that mistake and try to expand the arch on somebody by using the big daddy wire. You've got to put a rectangular wire in there. You put this buccal root torque in there, you bend this down, and you pull this up and put it in the slot, and it's got those teeth. The roots are taking force going in the outside way. And if you left the wire alone and didn't put something behind it, it'll push the crowns in the air more than the roots going out this way. So we put this big daddy wire on the outside, and that won't let the crown go in, and then over a period of time, the whole thing spreads out. I don't care how old they are, you just put it on there and it'll expand anybody walking and breathing, and it'll do it in adults as well as kids. And then all these teeth, the bicuspids and everything back in, we start with that, we call it progressive root torque. You bend this wire slow. I mean, you come in like that, and now the ones at the back will get more force than the ones up in the front. They don't have to go as far. And that's the way you expand an arch with a big daddy wire. And we don't have to put anything on the inside of the mouth to do that. Now this will bring it out, but I do use palatal separators because we hook the teeth completely solid up here and bend every tooth in the separator, and they hold the tooth rigid, and then that separates this way. Now somebody asked me, if I put something in there and put a bar over the top, let me draw this again, just to bring that up. And I'll bring this up again. If you got teeth like this, and you want to expand these, you want to bring them out in this direction, and you put a wire like this in here, and you put a band on it, and you straighten this thing out so that it's really bigger than the teeth, and you've got bands on them, and you hook it in here. The way this brings these teeth out, it swings this wire. If you carried it all the way, the wire would be out here like this. In other words, it would carry the tooth up, and it would be like this. And that's not what you want to do. So if you're expanding these teeth, it's going to make the lingual root go this way. But if you put a palatal separator, which pushes this way, and it won't allow the tooth to lean back, it'll bring us out bodily, or you have to put the buccal root torque in there like we showed, and then put a big wire on here that you can pull out, and you can put all the lateral force you want on there, and you can move the teeth out and keep the roots like this. You won't do them this way. So I hope everybody understands how teeth move. Now, if you say, well, I get this palatal separator, I'll just have it attached to the molar and I'll put a bar over the rest of the teeth. Well, the molar, with the palatal band it's soldered on, it'll go out straight, but as it goes back, the other teeth will lead in. It is better to band every tooth you hook up to the palatal separator and have it cemented solid so it carries the tooth out bodily like that, or else if you need to, you learn how to operate this large wire on the outside, but you've got to have a rectangular wire with it when you do a lot of expansion. You can do a minor amount, or you can take a tooth that's already tilted this way, bring it out like that. But if you take somebody that's already out here and you've got to put this buccal root torque in a rectangular wire on those teeth. And so this is not fully understood by a lot of people who are excellent orthodontists. Don't know that. And that's the way it has to be. So, and that's going to be that way 100 years from now. It's not something you're going to learn, and it'll be something marked out there. So I thank you for watching this. I hope this gets across to people who are really interested in doing good, solid orthodontics and not just junk stuff. And I want you to learn how to do that. And so I hope it's explained. If it doesn't, write us back and tell us what you want me to show here. And we'll try to show you how to do this. And you can get in this adult orthodontics. A lot of people just don't want to do it, adult orthodontics, because they've got to think a little bit the different things that are wrong. You can work with a restorative dentist and do a lot orthodontics. You can restore teeth orthodontically even, and we're moving the back teeth to the front, fill it in, or however. So thank you for watching, and I'm going to close out, and I don't want to hack people off and assume that you don't know this stuff, but there's a lot of people out there that don't know this. If you're an orthodontist and you know it, you go listen to somebody else. But anyway, people that need to know this, I hope this gets across to you. Thank you for watching, and I hope you'll join our group and subscribe to it. And I'll say goodbye and close out.